Good morning, Mr. Clark. Thank you so much for coming in today. As I said earlier, I'm going to ask you some detailed questions about your PTSD symptoms later on. What I'd like us to do now is to talk more about all of the traumas that you've experienced throughout your lifetime. I don't want you to go into a lot of details about the trauma. We'll have plenty of time to talk about that later on during treatment. And as I mentioned before, we have some really excellent treatments for PTSD. But for today, I'd just like to know some more details about the traumas that have occurred throughout your life. Details like how old were you at the time of the trauma, what happened, um, just a little bit of background information.
Okay.
So it may be difficult to talk about some of these traumatic experiences, but just do your best, and we can take breaks if you need to.
Yes. Okay. But it still makes me a little nervous to have to talk about it.
Absolutely, I completely understand that. We'll go slow and just let me know if you need to stop at any time.
Okay.
So before we get into the trauma, I see from the intake paperwork that you have MS. Do you have any other medical conditions I should be aware of?
No. But that's enough.
Absolutely. Multiple sclerosis is a really challenging disease. And what I'd like to do right now is just take a couple minutes so that I can better understand your physical and cognitive capabilities and how they may affect your participation in treatment.
Okay.
While it is important with most PTSD patients to go directly into talking about the trauma in order not to reinforce avoidance, in cases where your patient has a serious medical condition, you may need to assess the impact of their medical symptoms on functioning before selecting the most effective treatment options. Also, you may gain rapport with your patient by acknowledging the effect of his or her disability on their functioning in a psychotherapy setting.
So, when did you first start to experience symptoms of MS?
Uh, it started one day when I was trying to shave before a big inspection at work.
Mm-hmm.
I was 23, and I remember I kept putting my hands up to shave, but I kept getting air, like I was missing my face. I could see myself in the mirror, so I thought my eyes were playing tricks on me, so I closed them, and I still couldn't get my face. I had a really bad headache earlier in the week, so I thought that maybe it was just stress. So I called in and I took the day off. The next day I felt better, but then a week later it came back, and then it stuck around. My wife at the time scheduled an appointment for me to see the doc, and they said that maybe it was stress and just to keep an eye on it. But then a week later, my eyes started to bother me. I started seeing these floating things, like these dark spots. I went in for more tests, and that's when we found out that I might have MS. A scan of my brain confirmed it a few months later that I had several lesions on my brain that had changed over time. And by this time, I was having major neurological issues, so I knew it had to be bad. But I could barely walk. My hands didn't want to work. I quit writing a few years later. Some days I can pick up a pen and write on my good ones, but that's how my MS works. I have good days and I have bad days.
I'm so sorry to hear this. This sounds like such a challenging disease to live with. It sounds like you've really gone through a lot.
I have.
So I see that you're 28 now, and so your MS has been progressively getting worse for the past few years, is that correct?
Yes.
With major medical illnesses, it is important to capture physical and psychological functioning, limits and abilities for completing forms and therapy. For example, cognitive processing therapy for PTSD requires much more writing. Will he or she be able to complete the writing assignments? Prolonged exposure requires emotional processing and integration of information from the trauma memory. Will he or she be able to integrate information if there are cognitive deficits? Prolonged exposure also involves in vivo exposures. Will he or she be able to complete these types of assignments? Understanding limitations is crucial.
Okay, thank you so much for that information. Can I ask you some more questions about your MS symptoms?
Yes.
So I see here that you wrote down that you have an assistant. What types of things does he or she help you with?
He's mostly there to cook and clean. Uh, Sometimes he does laundry and helps me prepare basic meals.
Do you find that helpful?
Yes.
Do you need assistance with other things?
Sometimes with getting dressed or going to the bathroom and showering. Depends on my day. Buttons can be difficult. My fingers don't have the dexterity that they used to, but I have assistive devices that help. But sometimes I need Danny, my assistant, to help me.
Do you have any impairments with reading or writing or learning?
No. My memory's bad though, because of the MS and the medicines. And sometimes I can't see real clear because of the floaters, the dark spots in my vision from the MS. That's it.
Thank you for telling me that. So some of the assignments that we do in therapy involve reading and writing. And so what we can do is we can make some changes to make it easier for you. So one of the things we can do is either I can read your assignments to you, or we can use Dragon Speak, and you can also use Dragon Speak for your writing assignments as well, as we do some writing within the therapy. Are you familiar with Dragon Speak?
Yes, I am. I'm comfortable with Dragon Speak.
Okay, great. Sounds like that will work well for us. Are there any other symptoms of MS that may affect our work together that you're experiencing?
No, not that I can think of.
Okay. Well, please let me know if anything comes up, and I'll do my best to help us figure out a way to make things easier for you.
Okay.
Okay, so now I'd like you to tell me some more details about the trauma. I see here that you wrote down that you had an auto accident last year that's caused you some symptoms like nightmares and poor sleep. Could you tell me more about that?
When treating clients with MS or a spinal cord injury, don't make the assumption that the medical condition is the source of the trauma and PTSD. Start with the trauma identified by the client. Be open to hearing what he or she is reporting as the traumatic event.
Yeah, I tried to ignore it all, but it all got to be too much. I stopped playing basketball, which was really important to me.
I'm sorry to hear that. I can see that it's difficult for you to talk about this.
Yeah. I just don't want to do anything anymore. I thought that getting through the MS was going to be hard, but now I'll have to go through all of this, and the accident seemed to make the physical symptoms worse.
Yes, we see that a lot of the time in people with PTSD. The symptoms of PTSD can make medical symptoms worse. I'm so sorry you're going through all of this. It sounds like a very challenging situation.
Although you may not necessarily comment on this, you may want to consider the role the patient's MS played in the accident. Is he or she blaming himself or herself for not reacting more quickly, being drowsy from meds, causing or contributing to the accident? Also, in considering the impact of medication, be aware of the sedating effect of many of the MS medications, and clients may report significant memory issues from medications and medical conditions. Finally, we have seen a high rate of marijuana use, which could contribute to cognitive functioning deficits in patients with.
Well, what do you want to know? It was snowing. I was in the car alone on the freeway. I had just finished playing a basketball game with some friends, and it happened so quickly. I was going 60 one minute, and then I heard loud crashing, and when it stopped, I couldn't move, and my legs hurt.
That sounds so scary. I'm so sorry to hear this.
I thought I was going to die.
It's okay. You're safe now.
My whole body, My legs, they hurt and I couldn't breathe. It took forever for them to get me out. Now I just have flashes of hearing the crashing and the explosions. Even now I can still hear them.
You're doing a really good job. I know that this is really difficult for you to talk about. It sounds like such a scary experience. What was happening prior to the accident?
Well, like I said, I was heading home. I just finished a game. I was on the freeway and all of a sudden this car crossed the median. From what they told me, I guess she fell asleep at the wheel. It was snowing, so her SUV basically went airborne and hit a bunch of cars, including mine. I was trapped. I couldn't get out, and the steering wheel column was crushing my legs. Everything gets hazy from there, but I just remember the feeling that I was going to die. I do remember the airbag going off and I was smashed against it and I couldn't breathe. The whole back of my car was crushed in. The car behind me crashed into me too. They had to cut me out using the jaws. Even now I can still hear the sounds.
What a terrifying ordeal. First the accident, then passing out, then experiencing so much pain, and then the rescue having to be cut out with the jaws. It sounds like just a very scary and terrifying situation. I'm so sorry you went through all of that.
It was.
I can see it upsets you now just to even talk about it.
Yes, it does.
I can imagine you must have felt so helpless when you were stuck there.
I did. I do remember some people coming by after a while saying, "It's okay. You're gonna be okay."
That must have been a little bit comforting at the time.
A bit. But I kept losing consciousness.
So it sounds like your life has really changed very dramatically since this accident. Is that correct?
Yeah, I don't want to see anyone. I don't go out much. I used to see my friends all the time. Now I just don't see anyone to do anything. I don't even want to play basketball, which is why I came in. I don't want to lose my friends or miss out on the activities that I love doing. It's just hard.
Yeah. So what you're experiencing is a very common reaction to trauma. Other people have gone through this same experience that you're going through now. Thank you so much for going into detail about the trauma and telling me more about what happened. I know that it was very difficult for you to talk about. We'll keep talking about your trauma as we start moving forward into therapy.
Okay.
Have you ever had any other traumas like the accident in your life as a child or as an adult?
Well, now that you ask, yes.
What happened?
Well, when I was about 11, one of the neighbor kids drowned in the lake.
Wow, I'm so sorry to hear about that. What a terrible experience. Could you tell me more about what happened?
A bunch of us were out there, and I couldn't help them. Strange, I've been thinking about it lately. I haven't thought about it for years. Do you think it's related?
We see that sometimes with traumas bringing up other traumas from the past, so that is a common occurrence. Could you tell me more about what happened?
Oh, it was pretty awful. It was snowing, here again with the snow, and the lake was only partially frozen. Joey couldn't swim, and we were all out there. He felt their weak spot in the ice, and me and Johnny, we tried to help him, but he went under. I remember it like it was yesterday.
Wow. What a difficult situation.
Uh, it was too late. It was my fault. I shouldn't have let him go out there. I remember then having nightmares and waking up not being able to breathe.
Wow. That sounds so terrible. Just so that you know, this is another trauma like the auto accident. The reactions that you've had to the accident, Joey's drowning, nightmares, sleep difficulties, avoidance, those are all symptoms of PTSD.
They told me that, but I thought PTSD was just for military people.
So many people think that PTSD only occurs in military populations because that's where we first learned about it. But actually, PTSD can occur in anyone who's experienced a trauma like a life-threatening event. So other life-threatening events like earthquakes or sexual assault in combat can all result in symptoms of PTSD. And so the traumas that you've experienced, like the auto accident or like Joey's drowning, those traumas can also result in PTSD as well.
I see.
So has anything else traumatic happened in your life?
Not really.
So after listening to the traumas that you've experienced and also listening to your experiences with MS, I'm wondering if you've had any similar reactions to the MS as you've had to your traumas.
After the client has told you of experiences he or she considers traumatic, you can inquire about how their medical condition has impacted their psychological functioning and/or resulting symptoms, including any PTSD-related symptoms.
Well, when I was first diagnosed with MS, it was scary.
Mm-hmm.
It was that helpless state.
Yeah.
But I think I was more depressed then.
Mm-hmm.
I've gone to support groups for the MS and they've helped. And they're there when I need them. The helpless thing is definitely similar.
I agree. I think that there's this common theme of helplessness between your MS and the traumas that you've experienced. The helplessness with MS has been slower, but has still significantly impacted your life, just like the traumas did. Are you experiencing any other mental health symptoms besides depression?
No, not really. Just a control thing, and it's gotten worse since the accident. I try to control everything. That's why my wife left me.
Mm-hmm.
It seems like if I'm in control, I can keep bad things from happening.
Mm-hmm.
I was a control freak before, but after the accident, I've become unbearable. Nobody wants to be around me, not her or my friends. Yeah.
Wow, I'm really sorry to hear all of this. So, to me, if we look at your MS and we look at the traumas that you've experienced through your life, there are these really strong themes of helplessness between the MS and the traumas. So, with Joey's drowning, you were helpless to save him, and he died as a result. And that was such a difficult experience to witness. And then with your accident, you were pinned and you were helpless to get out of the vehicle until people came to rescue you, and you were stuck there for a long time. So again, these profound feelings of helplessness. And then with your MS, while your MS has been slower in terms of losing your abilities, it has also produced these profound feelings of helplessness that you weren't able to do some of the things that you used to be able to do. And so when you experience these traumatic events and then you develop PTSD and you experience these deep feelings of helplessness, what we find a lot of the time is that makes you try to control things around you even more than you were before. So it's very common that people with PTSD just really try to control everything in order to not feel helpless.
Yeah, that makes sense. I try to control everything to not feel helpless.
It is very common in PTSD. Have you noticed any other symptoms of MS that have gotten worse since the accident?
Yeah, my driving, I don't drive as much anymore. I haven't been down the road of the accident since it happened, which means that I go about 45 minutes out of the way to play basketball if I go at all. I drove here today, but it's just a few blocks from my house and I'm having a good day. I don't drive on the freeway anymore, and I definitely don't drive in snow or rain.
So that sounds a lot like the avoidance symptoms of PTSD, avoiding things that remind you of the trauma. I think that now is a good time for us to move into some more questions about your PTSD symptoms. But if anything else comes up that's related to your trauma or related to your MS symptoms, please let me know so we can talk about it more.
Okay.
So based on the information that you gave me today, I think that you're experiencing PTSD. The good news is that there's some very effective treatments for PTSD that can help you with these symptoms.
That'd be great. I just want to have a normal life again. I'm skeptical about being cured.
Yeah, absolutely. We typically don't talk in terms of a cure. The treatments that we have are very effective, but they typically just reduce PTSD symptoms. What would success look like to you?
Well, at the very least, I would like to keep playing basketball. I would like to hang out with my friends again, but I don't know if that's possible.
I'm very confident that if we work together on your PTSD symptoms, that you will be able to get back to playing basketball again and get back to hanging out with your friends again.
Okay, that sounds good to me.
You know, Mr. Clark, I would just like to thank you for sharing these really difficult experiences with me. You did such a great job today, and I really appreciate your openness and your willingness to talk about these experiences. So thank you so much for your courage.
Thank you.
And I'm really excited for us to start our work together.